Hello, this is Dr. Joe Muscolino. The following is an AI-generated simulated podcast of the contents of my ebook. I've created this and providing this because I believe that it is a very casual way and a comfortable way of listening to and absorbing the information. I hope you do enjoy it.
All right, so today we're diving into a topic, and I got to say, when this first popped up, I thought, Whiplash, really? But you know me, always up for a challenge, and you, the listener, you know what you want. So Whiplash it is, but the interesting thing here is the source you sent over. It's not your typical, WebMD overview, is it?
No, not at all. This is the real deal, this comprehensive manual therapy treatment guide for whiplash. This is for people who really want to get hands-on with this stuff. Manual therapists.
Right, like this is practical knowledge. This is, okay, I've got whiplash, now what?
Oh.
And it's written by, let me see, Dr. Joe Muscolino. So you know it's legit. But before we get too deep in the weeds here, I got to ask, when you hear whiplash, what's the first thing that pops into your head? For me, it's car crashes. Like, bam, fender bender, neck brace, the whole 9 yards.
Yeah, that's the classic image, right? But the thing is, and this is what I love about this guide, it's not just about the car crashes. It's about the mechanism, that sudden back and forth, sometimes side-to-side force on your neck.
Yeah.
It's about your neck going beyond its normal range of motion.
So it's less about what causes it and more about that movement, that force, which means
you can get whiplash from all sorts of things.
Give me an example. Besides the car crash, what else?
Oh, sports, especially contact sports, right? Big hit, sudden jolt to the head, that's whiplash.
Oh, okay, yeah, I can see that.
Or a fall. You trip, your head snaps back, boom, whiplash. I've even seen it with roller coasters gone wrong.
Roller coasters. See, that's why I don't do roller coasters.
Yeah.
But okay, that makes sense. It's that sudden, unexpected movement. But here's what gets me. If it's not just about the cause, how do doctors, or I guess in this case, manual therapists, how do they figure out what's actually going on in your neck?
Well, that's what's so cool about this source. It goes step by step through assessment, how to really pinpoint the problem.
So like what? They just kind of poke around?
Kinda, but it's a lot more precise than that. They'll look at your range of motion, for example. Active and passive.
Okay, now you're just using fancy words. Break that down for me.
So active range of motion, that's you moving your head on your own. Up and down, side to side, all that. Passive. That's them gently guiding your head through those motions.
Gotcha. So they're feeling for limitations, right?
Yes.
Places you can't go or where it hurts.
Exactly. And they're also looking at how your muscles are responding. They might use, it's called manual resistance. Like they might ask you to hold your head straight while they gently press on your forehead, seeing how strong your muscles are, if anything spasms up, stuff like that.
So it's like putting together a puzzle, right? Like they're gathering all these clues about how your neck is moving, how it feels.
And then they got to figure out, okay, what's actually damaged inside?
And that's where it gets a little more complicated, right? Because we're talking about muscles, ligaments. I mean, there's a lot going on in there.
And this is where your source is really helpful because it breaks down the difference between straining a muscle and spraining a ligament in your neck, which honestly is huge for understanding why some people bounce back from whiplash and others, they have problems for way longer.
So, what's the difference in terms of how it feels, how long it takes to heal, all that? What should we know?
So think of it this way. You know those big rubber bands, like the really thick ones? Imagine stretching one out, way too far.
Okay, I can picture it's going to snap back and probably sting a little.
Exactly. Now, that's kind of like a strain. You're overstretching the muscle, maybe even tearing some fibers.
Yeah.
So yeah, it hurts. It can be really painful, especially at first. But for the most part, it heals up pretty well. The rubber band goes back to its normal shape. A sprain, though.
Okay, I'm guessing the sprain is where things get a little more messy.
Yeah, you could say that. A sprain is more like if you actually damage the rubber band itself, like you put a little cut in it. Now it can't hold as much tension. It's weaker.
So with a strain, you're overstretching the muscle, but with a sprain, you're damaging, what is it, the ligament?
Exactly. Ligaments, those are the tough bands of tissue that connect your bones. So if you sprain a ligament in your neck, you're basically messing with the stability of the whole structure.
So even if that initial pain isn't as bad as a strain, you're looking at longer-term issues, right? Because it's not just about the muscle healing. It's about that joint, that connection between the bones being, kind of wonky.
Exactly. And that's one of the things that makes whiplash so tricky, because sometimes the symptoms don't line up with the actual damage. You could have a really bad strain that hurts like crazy but heals up relatively quickly, or you could have a sprain that's not super painful at first, but then you're dealing with instability and all sorts of other problems down the road.
Which is why, and I'm guessing this is where the manual therapy comes in, you need someone who knows what they're looking for to really figure out the best way to treat it.
100%. And luckily, your source, it goes deep into treatment options, both for the acute phase.
Hold on, acute phase. We got to
Yep.
break this down for the folks at home who haven't memorized this whole book.
Right. So acute, that's the immediate aftermath. Those first few days or weeks after the injury. Think ice, gentle care, maybe even a neck brace if it's really bad.
Yeah.
Basically, you're trying to calm everything down, reduce inflammation, and let those initial injuries start to heal.
Gotcha. So, don't go sign up for that kickboxing class just yet.
Probably not the best idea. But then, as you move into the chronic phase...
Which just means it's been going on for a while.
Right. So we're talking weeks, months, maybe even longer. That's when the focus shifts to things like restoring mobility, easing those tight muscles we talked about earlier, and potentially strengthening them to compensate for any instability caused by ligament damage.
So less about immediate pain relief and more about, addressing those long-term consequences.
Exactly. And that's where therapies like massage therapy, for example, that can be super helpful. Physical therapy, targeted exercises. Your source, it even talks about how sometimes your muscles will actually splint as a way to protect that injured area.
Splints, they get all tight and...
Right. It seems counterintuitive, but your body's basically like, okay, this joint is unstable. I'm going to tense up these muscles to try and hold it in place.
Like building its own internal neck brace? That's kind of cool, actually.
It is. It's a natural protective mechanism. But here's the thing. While that splinting might be helpful in the short term, if it becomes chronic, it can actually lead to more pain, more stiffness, less range of motion.
So it's like a double-edged sword.
Yeah.
Which is why understanding all of this, the difference between a strain and a sprain, recognizing the signs of muscle splinting, that's also important. Because then you can be more informed. You can talk to your doctor, your therapist, whoever you're seeing, and you can advocate for yourself better.
100%. Knowledge is power, especially when it comes to your health.
Absolutely. And speaking of knowledge, our source doesn't just focus on what to do after a whiplash injury. It also talks about what to watch out for, when it might be something more serious than just your run-of-the-mill whiplash.
Right, and this is so important because while whiplash, in many cases, is a relatively minor injury, it can sometimes be a sign of something more serious going on.
So what are some of the, red flags? What should people be aware of that might mean they need to, call their doctor ASE?
Well, numbness or tingling, for example, if you're feeling that radiating down your arms or your legs, that's not normal. That could be a sign of nerve involvement, and that's definitely something you want to get checked out.
Gotcha. What about, the pain itself? Is there a certain type of pain that's a red flag?
Well, if the pain is incredibly intense and it just doesn't seem to be getting any better, even with treatment, that's definitely a sign to get checked out again. But it's not just about the pain itself, it's also about other symptoms, like severe headaches that just won't go away, dizziness, changes in your vision. Those can all be signs that something else is going on.
Yeah, it's like whiplash is the symptom, but what's the underlying cause, right? And I guess that's where having that qualified professional, someone who really knows their stuff, that's crucial. Because they can figure out, is this just whiplash or is it something more?
Exactly. And even when it is, what we might call a straightforward whiplash injury, it can still really impact your life, especially when you think about that idea of instability we were talking about earlier.
Oh, that's a really good point. Because we've been talking about all the things you can do to, treat whiplash, right? The ice, the massage, the exercises, all that. But what about those everyday things you just can't avoid, even when your neck is still all messed up?
Right. Still got to go to work. You still got to take care of your kids, whatever it is. And those things, they might not be, whiplash friendly.
Exactly. So how do you navigate that? How do you balance the need to heal with the fact that, life doesn't just stop because you've got a wonky neck?
It's tough, for sure. I think it takes a lot of self-awareness, first of all, really tuning into your body, knowing your limits, and honesty, being able to tell people, hey, I can't do that right now. My neck is killing me. And then, there's the practical stuff. Maybe you need to modify certain movements, take more breaks, find ways to support your neck during certain activities.
And I'm guessing this is where all those exercises, those strengthening techniques we were talking about, that's where those really come into play.
Absolutely. Because it's about, building up those supporting muscles, improving stability, and ultimately it's about regaining confidence in your body's ability to move, safely and without pain.
Wow, this has been, I'm not going to lie, a lot more interesting than I thought it would be. When we started talking about whiplash, I never thought we'd be getting into all this stuff about self-awareness and adapting to limitations and communicating with the people around you.
It's all connected. That's the thing about health, right? It's not just about the physical stuff. It's about how all of that impacts your life, your relationships, everything.
So true. Well, a huge thank you to you, dear listener, for sending us down this, I gotta say, surprisingly fascinating rabbit hole of whiplash knowledge.
Always happy to dive deep.
That's what we do here. Don't forget to check out the show notes for links to some of the resources we talked about, including Dr. Muscolino's book. And until next time, keep those brains buzzing. And remember, even the most everyday topics can have hidden depths when you deep dive into them.
This is Dr. Joe Muscolino again. You've just listened to the AI-generated simulated podcast of the contents located within the ebook. I hope you enjoyed listening to this podcast and you found it informational. Thank you.